Okay, we are going to get started, so I want to welcome everybody to the College Research Seminar. I'm Marie Harvey. I'm the Associate Dean for Research in the College of Public Health and Human Sciences. And I'm delighted to see so many people here in person, and to all of you joining us via Zoom, welcome as well. So this is hybrid. I think it'll work fine. Our speakers are here, so this is nice, they're in person. Sorry, those of you on Zoom can't join us for cookies and coffee, but you might, if you have something close by, grab it. So, in addition to being delighted to welcome you all, I'm also really delighted to introduce Sunil Khanna. Dr. Khanna is a professor in our global health program, and he is also the Robert and Sarah Rothschild Endowed Chair in Global Health in our college. And so Sarah, I'm not introducing Sarah, I'm introducing Sunil. Sunil is an internationally known researcher in global health, and he's also the founder of our Botswana Global Health Initiative, which he is going to be telling you about today. And in addition to being a presenter, he's also going to introduce our guest speaker today, and he's also going to moderate our discussion and the discussion and the question and answer period. So again, reminder to those of you on Zoom, put your questions in the Q&A function, and not to take any more time, I'm going to ask you to join me in welcoming Sunil.
Thank you, Marie, and thanks to all of you for taking the time to come here, and to those of you who are joining us via Zoom. I couldn't be happier to be here to talk about the Botswana Global Health Initiative and tell you the story and how this initiative came to be, how we all started on this path to developing this very innovative program. And joining me in telling this story, initially, we were going to be three presenters who will be kind of tag teaming and talking about this initiative. Robert or Bob Rothschild, Sarah Rothschild, and myself. And Bob couldn't be here, unfortunately, but Sarah is here. So we will be two presenters telling the story of how it all began in Botswana. For those of you who are probably hearing me talk about the Botswana initiative for the first time, I've talked about this in my several presentations. Some of my students have heard me talk about this like every week. So just a brief background, the Botswana Global Health Initiative started in 2017. And initially we started this as an education abroad program with a mission to expose students in cross-cultural, global health, community-based settings where they are able to experience, manage what we call as culture shock, and continue to work in a productive way in a community collaborative manner. So that was the initial idea. And over the years, this initiative has now grown into incorporating not just education abroad or internship abroad opportunities. We have now added several research components to this. And now in the next phase, we were very fortunate to receive funding from USAID to actually get into some skill building or implementation of some skill building program and expand our work from one community to 5 additional communities. So that's the story. But this is a story that I started telling from 2017 onwards. But there is a very big chapter of the Botswana program that I think that all of you should hear about, and that's the chapter that started in 2005. And it's this story that we wanted to start our presentation with. So it's my distinct pleasure to invite Sarah Rothschild and join me up here so that she can tell you the story, because she is the one who experienced this from the very beginning. Sarah.
Okay, thank you, Sunil. I'm really delighted.
Just to put it in context.
Hold this.
Yeah.
Okay.
Do you want to put it in your pocket?
Oh, sure.
For Mike, give your hands free. Here we go.
Okay, well, welcome everybody. I'm just delighted to be here today, and Bob sends his regrets. If he could be here, he would. It was a medical issue that has kept him from attending today. And Sunil, it's just been an amazing story to see what Sunil and the College of Public Health here has done with just a stepping stone that started in 2017. But I want to tell you a little bit about the way that we became interested in Botswana. First, is anybody here from Botswana? Or has anybody visited Botswana? Aha. And have any people just visited Africa? Any country in Africa? Oh, okay, wow. So this is a story that I've told it many times, but I wanted to write it down, and that's why I'm going to just tell you a brief summary, because otherwise it'll get too long. In 2004, Bob and I visited some friends in South Africa. They had been doing some volunteer work in a township called Masiphumeleli, and they, on their own initiative, had decided to raise some funds to build a library there. There were 30,000 people, and then if you have been to South Africa, you know that the dwellings that they lived in were just very makeshift. And so they raised funds and built a one-room library, and that's when we visited there. And we saw how extremely popular that library was in this place where this is the only resource they had. We talked to our friends. They wanted to build a 2-story addition, and they were looking for help. And so we decided we would help. And at that point, we were in the process of selling our company. We had had a farm and a food production company in Ohio. And so at that point, we planned it that the next year we would come, and Bob would work on that construction of that new addition. At the same time, 2 friends of mine invited me to come on a Habitat for Humanity trip to Botswana. And that is how we became interested in Botswana. So I went on that trip, and I was just speaking with Susan about the life-changing experience that can be. We went to a village, the village of Madulako, which is someplace that Sunil is very familiar with. And we had no electricity and no running water. And so the village built a little enclosure for us to do bucket showers. And they also had outdoor privy for us. And these were the facilities. We brought our own tents, and we stayed in tents for 2 weeks, cooked over a fire with the help of women from the village. And it was incredible to go ahead and work with the people of that village. And that's what I think interested us in maybe pursuing something where we wouldn't just be donating, we would be working with people. So I've kind of left my notes here, so I'm going to just try and catch the line here. So we sold our business in 2005. Then we decided to start a foundation. It was going to be a self-funded foundation. That means we didn't have to go out and have a campaign to raise funds. So we knew what we could do. In a nonprofit foundation, you have to donate a certain percentage every year. And so we knew what that would be. And we thought, no, this is what we can do. We can build 2 libraries a year for 20 years. And that's how that number came up. We met with the government. They didn't quite believe it, but Bob has a way of being persistent. And he did persist and said, you'll see, we can do this. So the first year was 2007 when we started building, and we built 2 libraries, and they were amazed that they were finished on time, under budget. And then I'm going to be showing that first slide. When we launched into this project, not really knowing what we were doing in philanthropy or in starting projects where we could engage people. We just did it we blundered a lot, but people were very forgiving. That's one thing I love about Botswana. They know that if you're well-intentioned, they will accept you. Each time we decided we were going to go ahead and select a site for a village, for a library, we would meet with the leaders of that village. And then they would say where they wanted the library. They would take us to a plot. And that's what we're doing here. We're out looking at a plot that they had done. And then when there are a couple of things I want to call your attention to in this slide. One is the saying on the wall, Masuk is the village of Masuno. And in the history of Botswana, religion is very important. Christianity is very important. The missionaries from England came in the late 1800s. So there are many different variations of Christianity, but even in the government, every meeting begins with a prayer and ends with a prayer. And that was something that we were used to, but now we just accept it. And this is these are all leaders of the village who we've just come to that village to talk about a library, and they were wanting to pose for a picture. What we discovered after we launched into this, and we've been into it for a few years, was that if we would bring a few members of our family or young people, they got a lot out of it, and it can be a very impactful experience. And so these are relatives of mine who, and the library in the background is the first one we built, my Fodi, sorry. And I love the decorations on the outside of the building. We wanted them to decide what they wanted to do with the outside of the building. They chose the design, they chose the colors for the interior, and then they have a library committee that keeps things going and assists the library. These are all things that we learned really help make it a sustainable project. I don't. Anybody recognize Bob? Okay, he's hard to miss. This is again another a different library, and it's just whenever we go back, we try to get to as many libraries as we can to see how they're doing, to continue our ties with them, and meet with their library committee and then other village after years that want to meet with us, and so that's always a highlight of our trips. I also wanted to mention this is the current President Lasisi. The reason I'm showing this slide is because it took a while for people to learn to trust us. But after they began to see that we just really meant what we said, and we weren't sent by any religious group, we didn't have any ulterior motive, and we just wanted to see people have the benefits of a library. And so with each incoming president, we've been introduced and give them a chance to get to know them, and they know us. It's a small country, just 2 million people as far as population. The size of the country is the size of Texas. And so geographically it's large, but population-wise, not that many people. And this is what Bob he'll get after me if I don't do this. The mainstays of the economy are tourism, well, first diamonds, and then tourism, and then cattle. Maybe not in that order, but diamonds are extremely important. In the history of the country, in the late 1800s, 3 chiefs from villages went to ask for protection. And so, because the South African tribes were coming up and trying to encroach on the land of the Botswana tribes. So England came and acted as a protectorate, and they installed a government which was very loosely organized, and they didn't dominate the people as happened in other African countries where they were colonized. So it has a different history than, for example, Zimbabwe or South Africa. And the symbol of the country is a zebra, and many of you may know this. It's to illustrate and bring out the harmony between blacks and whites. It's between the races. So let's see that symbol. And there, how about? Okay. Don't touch the button. Okay. This is one of the activities that when I was visiting a library, they were sitting around a table. And you know, sometimes in the past, we thought in libraries you have to be polite. Well, these people are not polite. They were making little favors to sell for some kind of bazaar they were having, and they started to sing. And so when I just wanted to capture that music, that's so I did. Then they, of course, started to want to dance. So I think we get them touched. Go ahead.
About a toll 100 years, I think so. Let's go. There were pictures in the house. Good. Okay. We have the 2 minutes to run. Go birth. It's a picture. He doesn't have to. 2 more. 1. How did it's this back? It's kind of like. God.
It goes on. I get such a kick out of the joyfulness that is apparent when you are out of the village and you are the students that go with you will, I'm sure. When you go to Botswana, when you think of Botswana, you'll probably think of wildlife. They have done a wonderful job of conserving wildlife. I think that at least a third of the country is in game reserves and set aside for protection. So you can come around the corner and you never know what you're going to see if you're out driving around. Not give us it. And also we began to like to go out and camp. And so there you have a tent on top of your car. And then that's how you maintain your safety. There's a baboon in this corner. And I knew he was there when I was fixing breakfast, but we had 2 guys with deep voices with us, free, down in Bob, and so I didn't feel afraid. But he was very bold, and he jumped up on the table where his Lincoln patch toast, and he grabbed the loaf of bread, and his arm just brushed mine, and I could still feel that fur brushing my arm as he grabbed that bread. And then one of the guys, yelled and ran after him, but of course, he had the bread. I think basically the important things for us have been learning to know the people and learning something about how to do philanthropy and how to have a sustainable project. When you have a gift or money to give, there's an imbalance in power. And if you can establish more of a collaboration and not put on people what you think that they need, you can ask them and be sure and listen. And then once you start that dialogue, you can then let it develop from there. People will be engaged, and then they'll figure out what they need to do to maintain this. There are many things that I actually haven't gone into, but do you think of anything I've missed? Oh, well, I just want to say, because of having the experience of bringing the younger people and letting them go out and see what was happening, we decided it might be nice to bring students, and that's when we started getting to the idea of students coming over. The first year, actually, I went to the University of Michigan, and so we had a group of nursing students from there also, and the requirements of both those groups were so different that That at this point, kept it as a continued, but we are going to get back into another program with Michigan, has plans for us for a clinic for the first village that is for top of Sublizet. Is that a good transition?
That's a great transition, Tabe. Thank you. Thank you, Sarah. So one of the lessons that we learned from this history, and I was invited to go to Botswana on an initial visit in October of 2016. And one thing that impressed me the most is what Sarah just articulated, is the way in which Bob and Sarah worked with the government stakeholders and with community leaders and members of the community in a kind of ideal way. As most of you are familiar with community-based participatory research and community-based participatory building of programs, identifying problems, building of intervention strategies, and evaluating the impact of your efforts. All those ideas that I had learned in books and had done as a field worker were just being played out right in front of me, with Bob and Sarah communicating with community stakeholders and with government leaders. And it's so interesting that since that time, in several meetings that I've had with the key stakeholders in Botswana, sometimes I get the attention based on what I'm saying, and sometimes I'm usually ignored because they don't really know me, and who are you, and that sort of things. But in those conversations, I sneak in the Robert and Sarah Rothschild Foundation's name very purposefully, but I pretend that I'm being innocent about it. And just hearing that changes the complexion of the conversation. So what I wanted to impress upon you is that the program that we started in 2017 would not have been possible the way we have developed and the pace with which we have developed if not for the national level groundwork that Bob and Sarah had done in Botswana. So this is not just their support for the program, but also the relationship that they built in Botswana, both at the grassroots level and also at the community level. And we took really good lessons from there, and perhaps given the very local democracy kind of culture of Botswana, we incorporated some of these lessons that we have learned from observing Bob and Sarah and their team with stakeholders into every work, every project, every initiative that we came up with. So what we did, often we would go, we decided to work in a particular village for several reasons in terms of feasibility, but once we decided on that, it was the village that actually dictated and collaborated with us in terms of identifying priorities and developing strategies to address those priorities. So in the next few slides, what I wanted to do was to show you some of the priorities and some of the outcomes of our collaborative work, which is ongoing, and how we are building on those kinds of collaborative but sustainable partnerships with our community partners. So the village where we started this work, and now we are at the stage of expanding out of this community, is called Maunatala. It is located in the central eastern district of Botswana, bordering with Zimbabwe and South Africa. This is, by Botswana standards, is kind of mid to large rural community with 5,000, approximately population of 5,000 people. And I just wanted to throw out some kind of public health statistics for you, because this would have some bearing on what we will see in the next slide. So Botswana's national HIV as of 2022 prevalence rate is about 17%, and in this village it's about 18% or 19% around that. Although this is an alarming rate, but one thing we wanted to point out to you is that in Botswana, the public health or the health system is socialized. So the government manages and funds the healthcare system, and they have done an incredibly good job in terms of managing the HIV crisis, or so-called crisis in Botswana. The UN standards for HIV care at the global level are 90 people aware of their HIV status, 90 people getting treatment, and 90% of the people maintaining that treatment. In the village, that 90 figure is 96. So almost everyone in this village who's HIV positive is actually in treatment, in remission, and the viral loads are testing out to be pretty low. Approximately 5% of the village's population, especially the kind of older generation, they have lived with one or more disability, and this is again based on the initial surveys and initial household surveys that we have done. The reported incidence in the village, which is we believe is an underestimate, is about 28% for gender-based violence, and more importantly, it is important to see that in the village there is this growing problem of alcohol use by young people, and that, at least based on our initial understanding, appears to be something that's because of unemployment or just lack of positive youth activities or creative activities. So when we work in the village, we know that around 5 p.m. the local bars open, and people are just hanging out in that area, just ready for the bars to open. So those were some of the things that we noted in the village, and we brought it up for discussions with the leaders, and the leaders in the village then identified specific priorities that they wanted us to address. So we did not go to this community thinking, well, this is the project we think we would like to do. Would you give us the permission to do it? In fact, we went there telling them that these are some of the skills that we have. These are some of the ways in which we can collaborate. Would you please identify the areas that you think we can work with you? And based on that, the village community came up with 4 very specific priorities related to some of the epidemiological data that I shared with you in the previous slide. And one was that they were all concerned about what was happening to their youth with the increasing, alarming use of alcohol and some local drugs. And based on that, we worked with the community, with the youth leaders, and also with other stakeholders in the community to start this process that we started in 2019. We called it the asset mapping process, and based on that, we were able to identify some of the areas where we could really help the community. And with that, we developed what we call as the Community Advisory Board in the village. And it is this advisory board that is helping us now develop an education and positive youth development education and intervention program. Again, our role primarily is that of a catalyst or a facilitator as we work with the community. And that process itself has been very educational to us. As a researcher, at times it was hard for me to resist taking on the authority of the narrative. And it is almost like you have to kind of be very conscious that when we speak with the voice of authority, the voice of knowledge, and to some extent in a kind of Western-centric way, the way our education system has trained us. But if we are really looking forward to build long-term sustainable and effective partnerships that are meaningful in the local context, we should be aware of those biases that we bring. And nothing was more evident than when we started working with the local youth. Some of the assumptions that we had were thrown out of water by the local community members because they had what we call as the more local knowledge that we did. So the second priority that the community itself identified, and that is the disability awareness and inclusion priority. They wanted us to do an asset mapping in terms of what was happening to individuals with disability in the community, which for a very long time were mostly invisible, or if they were visible, there was somebody else who was speaking on behalf in terms of what their needs were and what problems they face. And we basically developed a program with the help of what we call as the Mauna Kea Committee of People Living with Disability. So this is a committee that came out of our conversation with its stakeholders, and it is this community that is helping us develop a collaborative training program that will be implemented in 2023 in terms of raising awareness on issues related to disability and inclusion, and also helping us do a resource mapping in the village in terms of which buildings and which centers of social activity were accessible to individuals with disabilities. So it was quite a fascinating experience that we had. The next priority, which is a more of a recent inclusion into the conversation that we were having with the village, and this particular priority was based on community experiencing a school-based gender violence incident. And this was the COVID time in 2021. I received a call. It was morning time in Botswana. It was midnight in Corvallis. We received a call that this is what has happened, and we would like to revisit our priorities that we have built, that we have developed with you. And this was a priority that they said that we want you to, next time when you are here, help us find ways to address this issue of gender-based violence. And we started working in 2022 with school teachers, healthcare workers, community leaders, and social workers, and we are in the process of once again collaborating with stakeholders in the village to develop GBV prevention programs. The community members were specifically interested in having this program target youth in middle school and youth in junior secondary schools. In addition to that, they also wanted the parents of these youth who were in these schools to be made aware of, so that they can have conversations when these young people go home. They can have a more informed conversation with their parents about gender, sexuality, and gender-based violence prevention. So this was again something that we essentially became kind of facilitators of these conversations, and our role was to find out some of the best practices that we have seen in community-based gender prevention programs, share that information with community members, and it was a community that kind of led this whole conversation for us. And the last priority that the community identified because of the high HIV rate in the village is sexual and reproductive health education. Now, Botswana is, as a country, had experienced the HIV crisis quite significantly in the past 20 years. Currently, Botswana's national level HIV prevalence rate is about 17 or 18%, as I said, but about 15 years ago, it was about 32%. And what we noticed, the impact of that high HIV rate for the past 10, 15 years is that what we saw is a missing generation. So you have in the village, you have youth in the age group between, you can say, about 11 to 20, and then you have the grandparents' generation. The parent generation is what we call a missing generation. So the village, just inspired by what was happening nationally, were very conscious in terms of providing HIV or SRH-related education at the school level. So we initially thought, so we will start with, junior secondary school, 14, 15 is when we get them, and we will start our intervention program. The village leaders and the healthcare workers told us that we were way off, that it would be too late if we started in the junior secondary school. In fact, we had to start in the last year of the elementary school. because, and this is something again was very hard for community leaders to share with us, given that the faith-saving society that Botswana is, that the first experience, the first sexual experience that most young people were having were in the last year of their elementary school because of sugar mommies and sugar daddies. And you are all aware of those terms. So we had to kind of come back and retool ourselves and really work. That started a 9-month-long journey to convince the IIB here that we will be okay if we started early in elementary school and then tracked students to middle school. So with the help of, again, village stakeholders, we have developed a comprehensive SRH education programs. The teachers are helping us not only develop this program, but they will also help us implement this program and evaluate this program. And again, just like the GBV, our prevention program, this program is focusing both on youth and the caregivers, which is kind of unique in the sense that for the first time we are proposing something where the caregivers are going to be actively involved in the SRH education program. A component of this program would involve youth and caregiver dyad, where they are working together to improve communication between parents and youth. So these are the four priorities that we have established so far with the help of the community. Again, we have the methodological tools and maybe access to some standardized tools that we can use for program planning, for program implementation, but these priorities were identified by the community, and we are working at every step of the way, from conception to evaluation of our efforts with the community. So our goal is to continue to collaborate with community partners. And one of the things that we are doing is we have now a little bit of data to actually share with the government, with the Ministry of Youth, Gender, Sport and Culture, and the Ministry of Health nationally, to showcase to them the situation in rural Botswana. And just like in many other countries, there is almost this urban policy bias, where many of the policies are kind of focusing more on the urban populations. So we are able to bring the youth Botswana experience and perspective to the government level, and that is really helping us upscale our efforts. We have recently started the initial effort to develop a Youth Mappers chapter in our college. In fact, just today I applied for an email account for the Youth Mappers chapter in the college. And what we hope to do is that this Youth Mappers chapter not only connect our students to this larger global community, but it will help us connect rural youth in Botswana with this larger global community through our chapter. And we're really, really excited about that. And that would be our next step. I hope that 2023 summer, we will have all of this in place. We were very fortunate with the help of OSU Foundation. We applied for a grant to USAID, and we were successful in getting some funds from USAID to expand our skill building program, our training programs, to 4 additional villages from Mauna Pala. And our hope is that this summer, which is turning out to be a very busy summer for us, will be the time when we will expand our programs from Mauna Pala to 4 additional villages in the central district of Botswana. And excited by our success with USAID funding, Bob and Sarah got really excited about this and basically said, hey, you need bigger space, so libraries are going to be, most of our programs are being run through the library, and they said libraries are going to be small for you, so we are going to help you build a community engagement center, or what we are calling is colloquially as craft center. And this will be the building that will help us house most of our programs through. So we will be in 2023, hopefully our first community engagement center will be built, and we will launch and test our programs through that. And finally, we couldn't have done any of this without not only this regular, constant mentorship of our partners. And we really want to take this opportunity to thank Bob and Sarah for creating an endowment here in the college. This endowment helped us really kickstart this great student learning experience in Botswana and facilitated the visit of several faculty members from the college over to Botswana. And hopefully those partnerships would help us develop even more research opportunities, community-based research opportunities in the village. Robert and Sarah Rothschild Family Foundation, as I said, was critical to my efforts to try to connect with government stakeholders and at least get a foot in the door. And in those conversations, when I felt things were not going my way, dropping their name was very helpful. So I really want to thank them. The College of Public Health Leadership, they have been just generously supportive of our efforts. And recent support from USAID, Oregon State University Foundations have been instrumental in moving things forward. I also want to take this opportunity to thank the Ministry of Health and Wellness in the government of Botswana and the Ministry of Youth, Gender, Sport and Culture. They have been constant supporters of our program. Every time our students are in country, every time we are in country, they help us with a van from the ministry and a driver, and they are always there for as long as we are in the country. They're always supporting us, which again tells us that, that maybe we have been a little bit successful in terms of building a trusting and collaborative partnership with them. All of these pieces have been instrumental in addition to what the community of Mount Nepal has done. They have really welcomed us with open arms. Just imagine 14 students descending on a community of 5,000 people and asking questions 3 times a day, similar questions. And basically, the community itself has taken on the responsibility of mentoring our students. And in that process, not only teaching our students, but learning from these students some of the issues that they had stereotypically understood about U.S. society. Yes, they know about 90210 and also some of the recent, like Melrose Place. Somebody was saying, how real is Melrose Place? So I don't know if many of you may be aware of what soap operas I'm talking about. So I also want to name the faculty members and thank them personally for participating and supporting our efforts. Dr. Megan McDonald, Dr. Will Massey, Dr. Roberta Ripotella, Dr. Sarah Rockyberg, they have been very supportive colleagues, and we are open to anybody who wants to come and see what Botswana program has to offer to them. So we're excited. Hopefully somebody else will join our team in 23. There are 4 doctoral students who are leading these individual initiatives for their doctoral thesis research. That's Courtney Jose for disability, Divya Reddy for SRH, Ivan Estrada for positive youth development and alcohol use, and Nikala Kowal for gender-based violence. So these are the people who have actually who are leading these initiatives. And finally, I'm very happy to report that 49 student interns have so far participated in the Botswana program. Thank you so much.
Thank you.
Yeah, I am ready to take questions.
Okay.
Sarah?
Anybody has something else?
You have a question, sir?
No, I want to invite Sarah over
Yeah,
here.
that's
please.
great. Please, yes. Yes.
I had a question. Sarah mentioned how important the church was in Botswana. I'm wondering, how does the church fit into your program, especially since half of them are related to sex?
Yes. Great question. In the village, and I think, and I'm just, presenting my opinion here, we haven't really faced any resistance from church leaders. In this community of 5,000 people, there are 19 churches in the village. And all church leaders have been very open. In fact, we get invited to their Sunday congregation meetings, and we get introduced to members. My guess is that, but this is a good question. I'll try to get into the research side of this. But my guess is that HIV has really changed the way the Botswana society thinks about sex and sexuality. So there is a sort of openness, but at the same time, careful openness about education. And they are all very interested in making sure that the next generation is aware and not making the mistakes that the previous generation did. In fact, so the village has 5 chiefs, and one of the chiefs came to me and said, "Can you help us make an HIV-free generation in the village?" And I was like, "Well, I will try, but we need support." And the next thing I knew, that I got introduced to all the church leaders, because this is where I could access the congregation and talk about SRH education. So this is my guess, that there is a little bit of an openness about this.
Thank you very much for your presentation. So I have been in Botswana, but haven't been there since 2019. And I was really impressed in 2020 in respect to sort of the continuation of the program. So I'm curious if you could talk a little bit about the community support that you have and how you managed, that year where you couldn't go.
Yeah, yes. Thank you so much for this opportunity to talk about it. So it was interesting that in 2020, when we realized because of COVID, we could not go, I was disappointed, and much to my, surprise, and I shouldn't have been surprised, that the community leaders were more disappointed that we were not coming, because they had these plans set up for us that we were supposed to do. And it took me a long time to convince them that really the international borders are closed and we will not be able to travel. So we ended up then developing a Zoom-based summer sessions of meetings. So several sessions of meetings that happened were actually Zoom-based. Again, coming out of the efforts of the community. We had given up on our side that we will not be able to connect, but they were able to figure out to get a Wi-Fi connection in the village, which is there, but not as strong as that you would have a Zoom-based conversation. But for the summer of 2020 and for the summer of 2021, we were able to have some students do what we call as the virtual internship by working with community leaders. So in a way, we physically went after a gap of 2 years from 2019 to 2022, but virtually we were connecting with them. And also we have a WhatsApp group that we are able to connect and be in touch with each other on a regular basis. Okay, Tammy.
All I can remember, Sarah, was in the old OSU Foundation, the conference room, and you and Bob were there asking me what is my best faculty that I've been connected with. You remember that? And I still can see that. And Sunil with one end and you two. From that point, I cannot believe the progress has made. And may I see the slides of your first one?
Sure.
The first one with the map. There's one with a map, Botswana with the... Yes, please. So as you were talking about it, I remember talking to Bob once. What you have done so far, almost like the model, the first touch point for OSU extension. You built, I don't know, did you say 19 of library in each of the places? If each one can be developed like the one that Sunil is doing, and the information probably don't need to be isolated in one area, and actually can be disseminated like OSU extension method throughout the country. So have you thought about that sort of box idea at that time we talked about? Is that something will continue? I can just see the impact throughout the country accelerated if we can use the same kind of system.
I'm really glad you brought that up, because that is what seems to be happening. As who would have predicted? I think we're as surprised as anybody. But yeah, we do thank you for mentioning the name of Sunil. And I remember I was in this room when I first met him. I was here for some kind of meeting, and then from there on, I think they say that action follows thought. If you have a thought, even subconsciously, you will be taking actions toward that, toward your idea. That's how I think of the live groups. Who would have ever thought? We intended to build one. But as we did it, we thought, well, we were going to build two then. And so then we thought, I mean, this plan to build 20. And, whether we'll get there or not, I don't know. But I do think that I'm glad you brought out the idea of to being a model. Many of these villages need a mix, and I don't think you mentioned it.
We have a mention.
Since 2016, Bob and some other people, and then Sunil was roped in, trying to organize and get agreement from the government to build a new clinic in this village. When we saw the present condition of the clinic where babies are delivered, there was barely running water. It was very unsanitary. And it's very old, from the 1970s, when it was first built. Hasn't been kept up. So anyway, we finally got approval. And that's in the works. The design was worked on. So one thing can lead to another, and don't give up on your dreams. Even if they seem like out in this world and too big.
Sunil announced that Sarah's a nurse.
Okay.
Yeah.
Yeah, you
I mean, she has her PhD too, so she's brings a lot to.
I'd have to put in a plug for the other OSU. I taught the School of Nursing at the other OSU. Yeah.
Laura.
I was just curious, this is amazing work, and I was a Peace Corps volunteer in Africa, so I was just curious if you ever collaborate with other aid agencies, USAID, Save the Children, Peace Corps,
Yes.
Is there a presence in Botswana, or are you able to leverage those volunteers?
Excellent question. And being a Peace Corps volunteer, that would be the first thing you would think about.
Yeah, absolutely.
Social library, Checkwood, Gambia.
Yeah. So when in 2017, when we went to this village for the first time with students, there was a Peace Corps volunteer. So Botswana has a robust Peace Corps program, and much of the focus of the Peace Corps in Botswana is about HIV and SRN. So when we went back and we stayed in touch with the Peace Corps leaders in the country, and then there was a transition of leadership of Peace Corps in Botswana, and in 2022, and we started our initial conversation where the Peace Corps leaders were very interested in expanding the scope of their work and training their Peace Corps volunteers to not just think about HIV, but to think about, other so-called social determinants of health. So our plan is in 2023 to have a Peace Corps training join us and see how we are working in the community, and maybe that could be a model to create those initial orientation sessions for Peace Corps workers in Botswana. So yes, really that.
Many Peace Corps volunteers are just out of
That's right.
their undergraduate, and that would be very impactful for them to learn.
That's right. Yeah. Roberta.
Yeah, I actually wanted to directly address Tammy's question because I had the pleasure of going last summer, and thank you for that, Sarah. And I specifically was asked to come to think about how Extension might think about what was going on in Botswana as a model for our Extension work. And the first thing that I came back with, I had the pleasure of speaking at our annual conference for Extension this December. I said to them, the libraries are their Extension offices. That's what they are potentially being used as, because the librarians are basically asked to do all this kinds of programming to bring to the community.
you saw the example of the women making crafts. So that I think that there's a lot of connection there, Tammy, with thinking about how we use our place-based faculty in a local office to bring out programs to the community. And of course, here we have the ability to connect to our university and take the knowledge here out through that library setting. So I think that there's a lot of connection and possibilities there.
Thank you. That was my purpose for bringing you there. And since the time I have come back, I've been having conversations with people in Extension to actually help us with what that community-based skill building programs, what those programs may look like, and how do we start those.
We have one online and might be a nice way to summarize it. So it says, what are the successes from the project in Botswana?
What are the successes from the projects in Botswana?
Yeah,
Well-
let's start.
So one of the successes that I would be happy to share is that the reinforcement that community-based participatory research, although it takes time, it takes energy, it takes a level of collaboration that we as researchers are often not trained. In the end, if we go through this immersive process of working in a community-based setting, it is extremely fulfilling at the level of the research and also at the level of seeing the results of what you are building. So that is one success that CBPR does work. It takes time to build and it takes energy to maintain those relationships. So essentially, one of the things that I see as an outcome is almost testing out and finding that the CBPR model works. The second success that I would say is that the community is engaged, the community feels responsibility for sustaining our health promotion, health education, and community development programs. So we feel like that the construction of this coming together of the community advisory boards and the advisory board that would lead the Positive Youth Development Initiative or the SRH initiative or the GBV initiative, that engagement, that level of engagement, I would count as success in the program. And finally, give me 2 more years and we will have success in numbers in terms of what we have accomplished and how many people we have been able to help. Thank you.
Thank you so much. I'm so sorry. Is that okay? Okay, thank you. I want to be respectful of your time, and so I just want to make a couple of very, very brief comments. So first of all, thank you all for coming today. I'm welcoming you to stay if you would like. Right now, there is starting a program sponsored by the Dean's Office, so if you want to wait out, there's some snacks and hang out for a little while. And then in about 20 or 30 minutes, I will ring this bell and it'll be time to come back in, and there's a little bit more program where we will integrate a little bit of fun and community building with some key information about some of our very impressive faculty members and definitely some surprises. Second, and more important, Sarah, Sunil, this is really, really remarkable. Lots of people try to do this, but you are successful for, I think, many different reasons. Now, one is clearly the level of compassion and generosity. I'm sorry that Bob can't be here today. Please let him know. Give him a big virtual hug for us. To both of you for what you've done. The second leg of the stool, though, is that we can't do this without really, really hard work. And Sunil, that's where you and your team come in. I mean, I see those reports come in every week when you're there over the summer and scrutinize them. And you can have a lot of compassion, but if it's not done right, you don't get this kind of impact. And then the third leg of the stool, which you mentioned a couple times, but I just think bears repeating, is how you are so appropriately using the principles of appropriate community engagement. And it has to do with community-based participatory research. Yes, it is extremely hard to do, but that is how you actually have impact. It's much harder because you don't control as much. They're coming up with the ideas. And then that's hard for us as in the training that we've had before. But when you really do it right, this is the kind of impact. So one last time before we go, could we please have a round of applause for these guys?